It was Treasurer Peter Costello who urged families to have one for mum, one for dad and one for the country. But despite the enforced stay at home, Australia's birth rate is declining, and that's expected to continue because of the health and wealth crisis. Coupled with next to no overseas immigration, it's bad news for an economy reliant on population growth. Rachel Papazzoni reports.
Lindsay DeFries and her partner Jessica Mayer's washing days will be a little busier in about 6 months' time. They're expecting their second child.
At the moment, we're the only people we know that are currently pregnant.
The New South Wales couple is bucking the predicted fall to Australia's birth rate brought on by the health and economic crisis caused by Covid-19.
It's a perfect storm for a bit of a demographic disaster.
Demographer Dr Liz Allen says it's a misconception we're on the cusp of a baby boom because many of us are now home more often than we've been in the past.
It's likely that we'll see people delay or possibly even forego during this next period of uncertainty and crisis because our basic needs aren't being met.
Fewer babies, coupled with the brakes being slammed on immigration, with estimates that could knock $50 billion off the national income this year and next, Australia's recovery is in for a long ride. Australians of childbearing age are facing a double whammy: uncertainty about their economic situation in the midst of a recession and anxiety about accessing health services as the pandemic puts pressure on medical facilities. That's something Chloe Devery experienced firsthand in Melbourne.
We still had to wear a mask in the ultrasound and all that, which was, I suppose, a bit odd.
She suffered a miscarriage between Melbourne's lockdowns, and her husband James was unable to be with her in hospital when she required medical assistance.
James was kicked out at the waiting room door. I think that affected him the most because he couldn't help. He had to leave and he was alone.
Former AMA president and Perth-based obstetrician Dr Michael Gannon says limited access to medical treatment because of Covid-19 has meant many couples are reconsidering having a baby.
There are people who were definitely afraid to attend doctors' rooms, to attend the hospital setting.
Like other developed countries, Australia's birth rate has been in decline since contraception was introduced in 1961. That's led to a stagnant natural population, the number of births minus the number of deaths each year. But the biggest driver of population growth is net overseas migration. Last year, it made up 60% of our total population growth, more than 210,000 people. And with the international border closed, net overseas migration has stalled. Coupled with the expected decline in the birth rate, it's not good news for a government trying to stimulate economic growth to pull us out of the first recession in nearly 30 years.
Population growth has been actually the major driver of headline growth rate, and about 2/3 of that has been overseas migration. So when you turn the tap off on migration, you do leave a big hole in the economy.
The government expects population growth to be halved from 1.2% to 0.6% next year. Economists like Danielle Wood warn trying to encourage women to have one for the country, like the Howard Costello-era baby bonus, isn't the answer.
I would focus probably on expanding the parental leave scheme that exists at the moment, as well as doing something seriously about the out-of-pocket costs of childcare.
While Ms DeFries and Ms Mayers considered the economic risks of having a baby during a recession before going ahead with IVF in June, it wasn't enough to deter them.
I guess it was more, we don't know how long it's going to go on for, and so we didn't want to delay in case there were then more delays.
Which means a lot more washing is in their future.